Our next category is our corporate achievement in healthcare, where we honor a company that has successfully implemented an innovative healthcare product, process, or service. In response to the need to address the increasing risk of hospital-acquired infections, Kenosha-based Kenall Manufacturing developed a new line of indigo clean light fixtures specifically designed for operating rooms and other healthcare settings. Nearly 1 in 25 hospital patients in the U.S. will contract an infection in a healthcare setting, and operating rooms represent one of the most challenging spaces to keep sterile. So these light fixtures install easily into the ceiling of any room and provide bright, high-quality white light to illuminate the surgical field, while a narrow spectrum of indigo-colored light is also emitted to disinfect the space. You still with me? This is highly complicated stuff here. Unlike UV light, Indigo Clean uses safe, visible light to kill harmful bacteria in the air and on hard surfaces and soft surfaces throughout the room, even while it's in use. We all need one of these in our home, right? Accepting today on behalf of Kenall Manufacturing is Cliff Yankee, Director of Clinical Affairs.
Well, so first of all, let me just say, for those of you that don't know us, Kenall Manufacturing is a privately owned lighting manufacturer. We started in the southwest of Chicago over 50 years ago, where our first products were used in the Chicago Public Housing Authority to address their specific needs. Since that time, we migrated to Gurnee, Illinois, and we make light fixtures for a variety of applications, parking lots, roadways, tunnels, pharmaceutical, correctional facilities, food processing, and as you see here today, healthcare. And so in 2014, we migrated from Gurnee to Kenosha, and we now are in a brand new 350,000 square foot state-of-the-art manufacturing facility where we make these really ruggedized, heavily engineered boxes that, oh, by the way, happen to contain a light. And we actually employ nearly 500 people, and we would certainly like to thank Governor Walker and his entire administration for bringing Kenall and its spirit of innovation and its jobs to the southeastern portion of Wisconsin at a time when manufacturing jobs are at a premium. Now, as I said, we started with this technology actually prior to my arrival at Kenall, and it's very interesting because many of you are probably familiar with light that kills, and that's the ultraviolet light. But in a previous life, I came across a group of scientists from the University of Strathclyde in Glasgow, Scotland, where, interestingly enough, they were looking for ways to kill bacteria, and they came across this. And so when I saw this, I realized, wow, this is something that is going to change people's life. It's just a real game changer. Pardon me. So I brought the technology to Kenall in 2013 when I joined the company, and we launched our first products in 2015. Now, as you might imagine, letting a group of scientists make a light is not necessarily a good idea. What you end up with is something that makes the room look like it's a disco club where everybody looks like a Smurf. So that's where Kenall gets involved. We're a lighting manufacturer. We understand how to make lights that are ruggedized and built to building code, which make very visually appealing white light. And so after several years of development work, we actually launched the technology here in 2015 with our first products. And we're very fortunate to have institutions like Frederick and the Medical College of Wisconsin and some of our partners down in the Kenosha area, in this case United Hospital, Kenosha Medical Center, who were our foundational clinical partners to help us show that this technology actually works in a clinical setting. Now, to be sure, the technology itself had been the subject of a young girl's PhD thesis for many years. In fact, she started publishing on it in 2008, so we had done a lot of work prior to that point. But to be able to release it through the hospital setting and commercialize it here with local support is really just been the best. And so we, of course, want to make sure we thank all of our partners at Frederick and the Medical College of Wisconsin and United Hospital for their support in that process. And so, of course, when you think about how does lighting and healthcare-acquired infections meet, well, the key point here is that we know that healthcare-acquired infections represent roughly about $100 billion in cost to the healthcare industry from excess costs, and that 1 in every 25 patients gets one of these. And so the idea of a light that kills bacteria is very revolutionary. Now, to be sure, if you ask most healthcare providers how they can help reduce infections, the first thing they'll tell you is just to wash hands better. And of course, when Ignaz Semmelweis gave us hand washing 150 years ago, that should have solved the problem. but in fact we know that the hand washing compliance rate across the U.S. is about 45%. And that's because we're all trying to do more with less, aside from the human compliance question. So healthcare providers are looking for new and innovative ways to provide a cleaner, safer environment for their patients. And one of them is through improved environmental hygiene. And in fact, the way we speak to folks is let them just kind of challenge them with the assumption that if you treated your building as if it were a patient, would you do things differently? And the answer is yes. Of course, people now are actually using a variety of new and innovative technologies in this challenge. And you may have even seen some of them at your institution. Some of them look like small little widgets like R2-D2. They walk in the room, they pop the head up, and they spray UV light around the room to help kill bacteria and so on. But those require people and time to operate, and those are very challenging things to ask of healthcare providers today. So when we saw this light that you could put in the ceiling, and it could be operated automatically through controls on the wall, and it could kill bacteria, we said, wow, this is a game changer. So here we are today with this exciting technology, and our presence is growing every day. We're actually in some new state-of-the-art facilities in Las Vegas, Nevada. They just had their grand opening, and now they're actually doing all of their OR procedures under these lights, and also in their emergency departments and waiting rooms. And we're expanding again our presence every day, and we look forward to reaching out to more people here in the Wisconsin area. But one thing you should certainly know is that when you walk into a room and you see a blue light overhead, you should know that your healthcare provider is providing you with a cleaner, safer environment. And so then let me just start to wrap up here by acknowledging that there's far more people than me involved in this. This is me accepting this on behalf of Kenall. So there's many people at Kenall who put their hard work into this. But I also want to personally thank the owner and CEO of the company, Mr. Jim Hawkins, for his commitment and vision to this. This is something that a publicly traded company or a private equity company would never go off and do. This is a privately owned company that has the vision and the fortitude to see something like this through. And that company is here in southeastern Wisconsin. And so we'd love to meet more of you. We're relatively new. We certainly want to continue to expand our relationships here, and we look forward to seeing you hopefully after the show. So with that, thank you.